This is Sherry Boschert reporting for the Global Medical News Network. The American Surgical Association invited Dr. Paul Farmer to speak about improving global access to surgery. Dr. Farmer is a professor of medical anthropology at Harvard University, an attending physician in infectious diseases, and chief of the Division of Social Medicine and Health Inequalities at Brigham and Women's Hospital in Boston. He's a founding director of Partners in Health, an international charity organization that provides direct healthcare services and undertakes research and advocacy on behalf of people who are sick and living in poverty. He was the subject of a best-selling book in 2003 by author Tracy Kidder called Mountains Beyond Mountains: The Quest of Dr. Paul Farmer, a Man Who Would Cure the World. His own books include Pathologies of Power in 2003. Dr. Farmer was awarded a MacArthur Foundation Genius Award in recognition of his work and has received many other awards. He sat down with me before his talk to discuss the global need for surgery. Why that? I know you're not a surgeon yourself, so speak to that.
Well, there are at least two main reasons, and maybe a third. The first one is that there's an enormous burden of surgical disease in the kind of places I work, rural Africa, rural Haiti. And that's unmet need. I've read that the average American will have upwards of 9 surgical procedures in his or her lifetime, and that number is 0 in rural Africa because there are no surgeons. Second reason is that there's a great deal of interest in young surgeons, in students and trainees in global health, as there is in young people in this country across the boards. And as a third reason, there are a lot of senior surgeons here, some of whom will be here today, who are champions of this cause.
Is that part of what you're looking for, is the personal angle?
That's right. Absolutely. I mean, I was lucky enough to get on this track when I was a very young man. And so my medical training has always been built around this since the first year of medical school. But other people have not had that good fortune. You know, if you're a surgeon, if you're locked up in the OR for years on end in training, it's a rigorous training. And they haven't always had or often had the chance to be involved in this sort of work. You mentioned cleft palate repair. It's an excellent example of what people in public health call a vertical intervention. So they have one thing they're focused on. They know how to repair cleft palates. What they need is really the context of a broader primary health care effort. Now that sounds like a bunch of jargon, but what I found is if you talk to orthopedists about how we could use their very specific, again, public health terms, vertical skills, or ophthalmologists about the pathology, eye pathology, or plastic surgeons about cleft palate. If people like our group, in Partners in Health is the group I work with abroad, if we can make this possible for them, electricity, operating rooms, lights, some of the supplies, then we can bring them in long term to this work.
Is there anything in particular that you're working on now that you want the surgeons here today or the video viewing audience to know about? Anything particular?
I guess my little secret stealth agenda is to share with the surgeons a vision of advancing the surgical agenda in global health. How do we do that? I mentioned already the sort of dry stuff, burden of disease, getting a handle on this. But there are even strategies we could pursue. And I mentioned maternal mortality for a reason. There's not a lot of overlap between public health and clinical medicine. This is an absurdity that grew up in the 20th century, and these two functions really became divided. It's even more striking with surgical disease. That's why there are still too few surgeons involved in global health. But the one point of overlap, those Venn diagrams come together around maternal mortality. And that's the stealth message. That's that we can use serious attempts to address maternal mortality as a wedge to drive forward the broader surgical agenda. If you put in proper facilities for safe motherhood, then you've got an operating room, electricity, lights, suture supply chain, etc. And then you can do other things. I mentioned cleft palate. You mentioned cleft palate. You can do some of the more complicated surgeries that are required. So I think that I've only been talking about this, we've only been talking about this for a couple of years, but in my experience surgeons are very interested to learn that that's a way in.
It's a wedge.
And so a wedge to move beyond the short-term medical missions that frankly I think are very important in surgical care.
For the Global Medical News Network, this is Sherry Boschert reporting.